morning, everyone. Thanks for joining us today for our monthly advocacy webinar. This is JP Dorval speaking, Manager of Legislative Affairs and Administrative Services. Hope everyone's staying safe, staying healthy, social distancing, because we are in strange times, and I do appreciate you guys taking time out of your day to listen to us, to hear what we have to say, to hear our updates. With us on the phone today, because I am tuning in from my own apartment, so the setup's a bit strange. I don't have 3 screens like I usually do. But on the phone with us today, we have PAA's Executive Director, Marcie Seidel, along with our Manager of Communications, Nathan Kraatz. So the structure of today's webinar will be similar to others. I'll go through a few updates. We will have a brief discussion about COVID-19, how it's affecting the prevention field and other things that people should know. And then we'll move on to the medical marijuana updates. So first things first, I want to mention this bill. I mentioned it about 2 months ago during our February update. But there is a bill that was introduced, House Bill 532, Mental Health Education Standards. And if for some reason you can't hear me, just please let me know in the questions box. That way I can figure out whatever technical issues are occurring, and I can ameliorate that immediately. But yeah, so House Bill 532, sponsored by Representative Brinkman and Representative Kelly, similar to the Health Education Standards Bill, but this focuses in on mental health education standards. It says that you have to have, or it asks schools to have mental health education standards in grades pre-K through 12. And when it comes to what these standards are, these standards include mental health, mental well-being, depression, anxiety, drug and alcohol abuse, bullying, and harassment, similar to our to the mental health first aid curriculum, things of that nature. And the only reason why I'm bringing it up again is because after our February webinar, we at PAA did have a phone call with Representative Kelly to discuss it, to discuss the path forward for the bill, especially given that the General Assembly is not meeting as often as it would be because of the COVID-19 pandemic. And she did say that they feel like there is a path forward for the bill, even though it was introduced late. They were looking towards lame duck as a possible time to get this bill either added to another bill so it can get passed or push it through. It has not had a first hearing yet, so that's really the biggest obstacle. And I'm not quite sure when it would, because right now, the last session that the General Assembly had was about 2 weeks ago, when they introduced House Bill, or they passed House Bill 197, which was the state's COVID-19 response. But there may be, depending on how things shake up in the next couple of weeks, there may be a few sessions during the summer where a hearing on this can happen. So just wanted to recap that to say that the sponsors of this bill are looking forward to trying to get this passed. They're also considering having another stakeholder meeting, just so that they can hear from the community, because that's one thing that we did bring up. We did say that we would love, as prevention professionals, to have a seat at the table, given what this bill is addressing. We do think that we should be part of that conversation. So they're looking at another stakeholder meeting. They're looking to get this passed next fall as the General Assembly ramps up for the end of the year. So that's all the updates I have regarding House Bill 532. If you have any questions, feel free to send me an email. It's a great bill, so we'll keep you guys updated on that as that bill moves forward. So other General Assembly updates, and I mentioned this during our PAA Town Hall, which was about 2 weeks ago now, and then also in our weekly legislative updates. But House Bill 197, the state's COVID-19 response, was introduced a while ago, actually, by Representative Jenna Powell and Derek Marion. It was supposed to be a tax code error-fixing bill. So it was supposed to fix typographical errors in the tax code, but what they did is they introduced a massive amendment to turn it into a COVID-19 response bill. And since it was already at the tail end of its processed within the General Assembly. It was already in the Senate, and just had, I think, one more or two more committee hearings to get passed. They decided to use this bill as a vehicle to get the COVID-19 relief stuff passed and sent to the different state departments and the individuals who need it. So that bill did pass and is signed. So everything within that bill, including the stuff regarding the primary, where now it's a mail-in ballot, that was all included in there. I did send out, following our PA town hall, I think James did, the summaries for that bill. So if for some reason you don't have that and you have a question about what's in the bill, feel free to let me know. I can send that your way as well. Last Friday, a few other bills were introduced. I'm not quite sure how many bills regarding the COVID-19 pandemic have been introduced within the state so far, but there have been a fair number. House Bill 605, workers' compensation, to make COVID-19 contracted by an employee of retail food establishments or food processing establishments an occupational disease under the workers' compensation law, and then House Bill 608, to make changes to the law regarding peace officer and firefighter certifications. And the only reason why I'm including these is because I feel like even though they don't necessarily directly apply to substance misuse prevention, these, at the end of the day, affect all of us. This pandemic is affecting all of us, so I did want to keep you guys up to date about something. Obviously, I'm not going to list out all the bills that were introduced, and not all the bills are going to get passed. But as things come up and as things pop in that I find interesting, I'll definitely let you guys know. But these are just a couple things that the General Assembly is looking at currently to help different populations within our state handle this pandemic. So the Ohio primary, and I've said this a lot, I've mentioned this a lot, and I don't want to, reiterate too much, but the Ohio primary is still going on. For those who haven't yet, ballots must be postmarked by April 27th. So we're doing a mail-in ballot system for this primary. Feel free to go on the Secretary of State site if you're registered to vote. Pull the ballot request form. It's a PDF off the site. Fill it in, print it out, send it in to your local county board of elections. They do have a directory for the county board of elections on that site as well. Once you mail it in, you'll receive a ballot back, fill it out, mail it back to your county board of elections. It's pretty simple. It's a simple process. If you have any questions about that, just let me know or put the questions in the question box. But yeah, you still have time to put that request in. So now I'm going to move on to a general discussion about COVID-19, about the prevention field. I'm going to have both Marcie and Nate chime in about this. It's been an interesting time. At the federal level, as I've mentioned before, the Senate passed the coronavirus relief bill, the CARES Act, which has those $1,200 payments that everyone's been talking about on the news. I do want to touch on this, though. There has been, and this is the only topic where there's been misinformation, but there has been a fair amount of misinformation spread about this. I was sent something yesterday by a coworker where people are saying that this relief stimulus package or this tax credit will be counted against you next tax cycle and that you're going to have to owe the federal government $1,200. That's not true. I did email an accountant that I know, an accountant who's actually on our board about it, and that's pretty much what she said. It's a new credit that they're creating, and they're giving it to individuals who qualify in advance. But if you have any questions about that, I highly recommend you talk to a tax lawyer or an accountant that you know. Please do not look up a video on YouTube where it's some person explaining it and expect that to be the truth. A lot of people are trying to bank off of misinformation to cause panic and what have you. So please be cautious, not only about this, but about any other information coming from an individual source, a source that's not a newspaper or news channel or someone within a accreditation. So please be wary of that. And, just as a recap, there are a lot of groups who are going to benefit or who are benefiting or who will benefit from the CARES Act. Nonprofits can apply for some funding through this. So if you are a coalition and you're having issues with cash flow or issues with just anything monetary going into the end of the year, end of the fiscal year, I highly recommend that you look into this. There may be things that you can apply for to help bridge any financial gaps that you are experiencing. And moving on, so yeah, misinformation, please be careful about that. COVID-19, the data is showing that it's disproportionately affecting our minority community. I think the Department of Health released last Thursday that 20% of the coronavirus cases are cases that have or that involve African Americans, but the percentage of African Americans in the state is a smaller number than that. So just please, this is a time to remember cultural competence. It's a time to remember that people are suffering and people are really getting affected by this in different ways. So just keep that in mind. And really, at the end of the day, the things that the state's doing, the stay-at-home orders, the closing of different common places, it all really falls under prevention. We're trying to prevent people from getting this. And it's been very interesting to watch, people protesting at the governor's press conferences about what he's been doing and asking to open up the state, saying that the numbers that we're seeing are lower than what was projected. Well, that's the case because, that's just prevention, right? You don't know what you've prevented if you prevent it, right? So, of course, the numbers are going to look a little better. And I think now is a time that we should take pride in being preventionists and that we should look towards the future as our healthcare system. So our healthcare system is never going to be the same after this. So as we rebuild and revamp our healthcare system after this thing is over, we do have to make sure that prevention is a pivotal piece of that new healthcare system, and is a pivotal piece of education not only throughout our state but throughout our nation, because prevention is important, obviously. So there's also been a couple interesting tidbits of information and articles on COVID-19's impact on marijuana users and COVID-19's impact on vaping. And Nathan, I know you've read up on this, if you want to chime in about it.
Yeah, sure. I was going to say anything right now, it looks like anything that attacks the lungs is just a bad idea right now. In fact, that's really the statement from the American Lung Association. In specific, they're saying that they know that it's hard for people to quit smoking, but right now they're really urging people to seriously consider it and get the help that they need doing it. There are opinion articles running in national magazines and news sources about how it's important right now to really redouble efforts to, as public policy, to get people to quit smoking. So talking about making insurance cover more cessation treatments and providing more public resources for quitting smoking, because there's a lot of information out there that suggests very strongly that using cigarettes or marijuana or e-cigarettes will cause that inflammation in the lungs and make you more vulnerable should you contract COVID-19. And I think some people are concerned, though there's no research done on this, that there could be enhanced spreading of the virus because of the inhalation and the exhalation. But what was, I guess, perhaps not surprising, but bald-faced, is that there are a lot of vaping companies right now that have taken that message and are running with it and saying, well, we're not smoking. We're trying to get people to quit smoking. So we're part of the solution by getting people to buy our products. And so in particular, there are advocacy groups and businesses that are taking this opportunity as a marketing opportunity to sell more vapes and to sell more e-cigarettes and to get people using their products more. They're really focusing on the fact that there's so little known about the virus and how it impacts the lungs and how those impacts might interact with e-cigarettes, and they're using that as proof, even though it's not proof. They're using that as marketing proof that their products aren't dangerous right now, which they've been doing for years. So we know that that's not true because e-cigarettes are not safe. But they are still using that. And they're actually using that to say that, well, smoking is not safe. We know this, and it's especially not safe now. So you should try vaping because they think it's, they're arguing that it's safer, which again is the message we've been hearing from them for years, and the message that we need to be counteracting. There's also one company, at least in Rhode Island, that thought it would be a great idea to drive through hospitals or around hospitals and sell their e-cigarettes for $1 to people in the parking lot there. And it's just amazing the kind of marketing tactics some of these companies will come up with. In particular, that business owner said that the campaign was conceived because many of his clients are nurses, and it just is, and doctors, and it just is disappointing to see people taking a pandemic like this as a marketing stunt and opportunity to make a little more money, particularly by selling something that is most likely going to cause more harm at this juncture. So keep an eye out for that. As always, make sure that you can correct any misinformation that is out there. We will continue updating the e-cigarette section of our advocacy updates, so keep an eye out for that. There will be some good information in there about what the American Lung Association is saying, and use that. Build your argument on truth, and hopefully the truth will win out.
Awesome. Thank you, Nathan. So if anyone has any questions about what we just discussed, vaping, marijuana use, just let me know. Put your questions into the questions box. I did want, and this whole discussion reminded me of this, the marijuana ballot initiative that we mentioned in our February update, and I believe also our March update, not quite sure. But the ballot issue that we've been mentioning has not moved forward. Last time I heard, they were sent back to get more signatures, and the second time that they went to get signatures, the 1,000 signatures, before they could actually start collecting the actual signatures for the ballot initiative, those signatures could not be verified. I think only 200 and change out of the 1,000 were verifiable and were good. So it's my understanding, and Marcie, you can chime in about this as well, but it's my understanding that that ballot initiative won't be on the fall ballot. They don't have time to gather those signatures, especially with all the stay-at-home orders and stuff like that. I mean, really any ballot initiative right now trying to gather signatures, they have a massive mountain to climb. But when it comes to this ballot initiative specifically, I don't see a way that they could actually get this on. So just wanted to update you guys on that. Marcie, you have anything to say about that?
Yeah, I was indeed going to talk just a little bit about it, and thank you, JP, for leading into that. It has been, as JP said, pretty much knocked out of the arena for this particular election cycle because they didn't get enough signatures, and I'm sure that this pandemic and social distancing and staying at home orders have totally interfered with it. It's important to know, though, as I talk to some leaders in the community who are pretty skilled at doing campaigns on issues like this, basically said that this particular group made some very freshman type errors in it. So it means they weren't the people that we should really be concerned about putting a ballot initiative on. Basically saying you would not ever come to the Attorney General's office with just a few more signatures than what you thought or what you needed. So they needed 1,000 signatures and they came with very few. And of course, to only have a quarter of them or less than a quarter of them to be valid signatures is just is inexcusable for someone that's trying to put together a campaign. Having said that, what's the important takeaway from that is that those that are very skilled at putting the initiatives on the ballot and those that have a lot of money to put it on the ballot are waiting in the wings. And they are letting groups like this kind of soften up the world to be thinking about these types of things. And so while it probably won't happen in 2020, we believe that it probably has a good chance, depending on where we are in the world with the pandemic, but it could probably happen in 2021. So we need to be prepared for that. With that in mind, Prevention Action Alliance now is working very steadfastly on putting together some fact sheets that we'll be able to distribute to you and to all in the communities to start to get people to understand what marijuana is and how it impacts society and individuals. So be looking for those in the next couple months that we'll be hopefully getting those out into your communities to put to use in the work that you do. So yes, not happening now, but will happen, and it's time for us to ramp up and get ready for it. And I just wanted to take just 1 second just to underscore or highlight what both Nathan and especially JP talked about, the importance of prevention. We're seeing now prevention at work in a public health setting where we take the science, we've taken the research, and we have put together a community-based and environment-based plan that has actually reduced and changed behaviors so that this pandemic is not running rampant through our communities. The prevention models that they're using have worked, but people are not understanding them. One of the things that I read today in an article is that everybody is thinking we need to get back to work, we need to get going. And yes, we do need to do that, but we need to be thoughtful about it. And there's a tug of war kind of going on at the federal level and the state level about how all of that works. And people are saying, well, we don't have that many cases in Ohio, so we should get back to work. We prevented them. We prevent them, and people don't understand that it was the prevention techniques and strategies that we used, the governor used, that have made this to be where it is today and not a huge problem like they have in New York. So we can't let up. And what I would encourage and all of you is to reach out to your legislators and your senators to help them understand how prevention works. That should be our charge, and it will be our charge at Prevention Action Alliance going forward through the rest of this biennium and into the next biennium, that they understand the importance of prevention and how it works. So that's the call to us, I believe, today, and for the next, for the eternity, is to talk about the importance of prevention, and this is a good backdrop to show how prevention works. So thank you for doing the work that you do. And we're in it together, as they say. Thanks, JP.
And thank you so much. Thank you, Marcie, for mentioning that call to action. And I do want to stress that additionally, there are members of the General Assembly, representatives and senators. I don't quite know who exactly. I know a couple names that are asking that we open up different parts of the state. And the reason for that is they're hearing from the business community mostly. And the business community's stance is, well, we're suffering and the cases are not as high as they were projected to be, or the case number isn't as high as they were projected to be, so let's open it up. And I really do think, as Marcie said, this is a pivotal time for the prevention field. Please reach out to your legislators. Especially if you're operating out of a more rural community, please let them know that all the things that the state's been doing to prevent this disease, this pandemic from spreading, has been helping. And it's important that we continue to do that until we are able to really fully track who has it and how it's spreading. Because if we open up the state now, and there's been pressure from the federal level, there's been pressure from businesses, the community level to do that, we're not going to see this thing pass, or we're not going to have a healthy community or healthy communities for a long time. So please, just want you guys to heed that call to action. Prevention is working, and we definitely need to say that and let our legislators know that it is working. Marcie, I'm actually going to turn it back over to you for the medical marijuana update.
Oh, great. Thanks. I appreciate that, JP. We're going to go through it real quickly. We're running out of time here. Just to let you know, not much has changed as far as cultivators. That's stayed the same in this last month since we've been together. Dispensaries, we're up to now, there'll be ultimately 57 provisional licenses that will be out there for dispensaries. We're at 51 right now, so it's slowly inching up to its what anticipated full capacity. We can flip the slide there, JP. We can see here there's been really a lot of uptick in the medical marijuana sales figures, as you can see here, and I won't run through them, but they are coming up, and a lot of this during the stressful time. It'll be interesting to see based on these figures. These are through the beginning of April, so as this pandemic goes on, and it'll be interesting to track how the sales and things increase or not increase. Will just be good to have that kind of information. And then certainly processors are slow to be on the way. Only 17 out of the 44 are there, but those are the things, the people that change it from raw material into different products. Okay, flip it. So here's our recommendations. It's just a really up to over 100,000, actually 102,000 recommendations have been given, which is up significantly since our last month. And you can see here, the registered patients are up, veteran status, everything is up as we've talked. And again, noting that we're up to 506 terminal diagnoses that are recommended marijuana. Physicians, it's still plateauing. I don't know that they've had any other board meetings that have increased that CTRs, but the last count that we have shown is about 613. Okay, JP. We talked about this, just not enough signatures, so we can flip past that. We've discussed that well. And then we talked about, if everybody is staying in place and not moving, and the medical marijuana control program has been considered an essential business. So that means all the dispensaries, the cultivators, and all pieces to the bringing of marijuana to patients. They are not closed, they are still in operation. They have changed things a little bit in that instead of having 2 caregivers, an individual can now have up to 3 caregivers. If you don't have, if your ID is not up to date because you can't get to the bureau to get a new driver's license, they will let you after 2/1/20 if you haven't gotten it renewed and it's expired at that time, you can use alternative forms of ID, or you can use that one, but it has to be eligible, and you have to have a caregiver whose ID is not expired. They have on their website, they have lots of guidance and checklists for individuals that are using marijuana as medicine. And then they've also, so that people don't have to go inside to pick up their marijuana, they have curbside pickups now, so you call ahead and they'll be waiting for you. If you do exchange money, which you will exchange money, the money has to go back inside the minute the exchange is made. It's not like they can sit there and take people through a lineup of one car after another and get them their things. So there has to be the money inside, so someone is not standing outside with a lot of cash. And they also have given the doctors who are CTRs, certified to recommend, have given them the ability to use telemedicine to provide the individuals with their medical marijuana cards. So during this time, the systems that have been in place to really help with the diversion and to make sure that we have a very tight system for the control, or a control system for medical marijuana, have been loosened. And these are things that, as we return to normal, we will take a look at to make sure that they can kind of go back to the original way. I believe they're all been put together as temporary guidelines, but we'll see. Once something like that happens, we'll have to double check on it. Okay, is that it? Do we have anything else? I think that's my last slide. Is that correct, JP? Yeah.
Yeah, that's it. So give me 1 second. We do have a question coming in. So if you do have questions, please let us know. Put it in the questions box, and give me 1 second. Let me read this. So one of our listeners, actually Kerry Metzger, asked a really good question. And Marcie, I think you'll be able to chime in on this. He's asking if the $17 million, or the funding that we got from the last biennial budget, he's asking whether that funding is at risk because of the COVID-19. So is it going to be cut? I think that's what a lot of us are asking. How will this crisis affect prevention funding that we fought so hard for last budget? Marcie, do you have any insight into that?
I don't have any definitive answers for that question, but I do know that the Department of Mental Health and Addiction Services is right now looking at, have been given, actually all departments have been given an order from the governor to look how to reduce their funding by 20%. And as I listen to the calls the stakeholder calls with OMAS on a normal basis, I think we used to do it 3 times a week, we're down to 2 times a week now. One of the ongoing things about that is about crisis, like the crisis that we're in right now, and crisis funding and crisis policy to help people during this time. And so you can see in many cases, which happens all too often, we start putting the money where there seems to be the immediate fire. And there's a lot of fires out there right now with people who are struggling with addiction and mental wellness issues, and people that are homeless, and people that are struggling to get to their mental health providers. And so, we need to, as a group, anticipate there could be a cut away from us. And that again goes back to the advocacy work that we need to do, that we need to still advocate for those funds so that we can stay out ahead of all these crises. So I wouldn't be surprised, but I don't have any inside information at this point. We're going to watch it. We're watching it really, really closely here.
Right. And thank you for that, Marcie. And kind of adding on to that, people are really turning to different substances to help them cope with these times. So I think an argument could be made that when next year's budget rolls around, we actually need more funding. We need higher funding levels than we received in the previous biennium, because people are going to be dealing with the consequences from this pandemic for a while. I know marijuana sales are up. People are drinking more. People in self-isolation are suffering from different mental health issues. So I think definitely a case to be made that we need a higher level of funding this coming budget. So, as Marcie said, I think the state's looking to cut in different places. I know they are looking at the quote unquote rainy day fund to kind of fill some of those funding gaps and the tax revenue gaps that are coming up because of all of this. But I definitely do think that an argument could be made in the opposite direction, saying that, you guys gave us this money, this amount last General Assembly or last biennium, we need more now because of what we just went through. So, but yeah, I mean, we'll keep everyone up to date on that as we hear more. And I'll wait a couple more minutes. Let me see. So it seems like that was the only question, but Nathan did want to add that individuals are smoking more too, vaping more. So it kind of goes back to my previous point that a case can be made that we need more funding. Alrighty, so it looks like we don't have any additional questions. Thank you for that one question, Carrie. It was a good question. If you guys have anything additional or something comes up after we sign off that you guys want to know, Marcie's email is up on the screen. And my email is same ending, it's just JP Dorval, JPDORVAL @PreventionActionAlliance.org. Just let us know if there's anything that you guys want to know. We're keeping up to date, but things are changing daily. So you guys might actually be more informed than some of us. So feel free to share information as well. It also doesn't only have to be questions. If you have information about what's happening, you hear something locally in your communities you want to verify, just let us know. We'll try to get to the bottom of it. But thank you so much for spending your time this morning listening to us. We actually had a lot of listeners tune in, or a lot of individuals tune in for this webinar. So thank you so much, and we will see you guys next time.